as the pathological stages, so it's a urgent case. I will involve my ST2 after ensuring her competence level, and midwife will be involved here. So their may need is already 2 caput plus, and may need instrumental delivery for that. Room number 8.
So, okay, room number 8.
Room number 8. Yes, room number 8. She's para 2, 20 weeks pregnant, termination of pregnancy by misoprostol for fetal abnormality, no contraction is there. I want to know whether there is a risk factor present or not. And what is her abdominal vaginal findings, and misoprostol first dose given or not.
Okay, so first dose given, vitals are stable. She does not have any sign of labor or any contractions yet. And blood test results are also back normal. Everything normal.
Okay, so this is a routine case, non-urgent case. I involve my midwife, and according to the protocol, I want to give second dose of misoprostol accordingly.
Mm-hmm. Okay, thank you. Okay. Nausea. Nausea, I'm gonna kill you, you know. Nausea, please don't mind. You failed this station.
Okay, so what is the problem?
There are so much problems, you know.
Yes.
There are so much problems. I can see that you are actually the way you presented is so nice. Was so nice. Let's come to the good points first, okay? You did well. You spoke beautifully. Your English is so good, and it is at least the examiner can understand what you are talking. You tried your best to be very quick and try to finish it quickly. But what were the points? What were the important points?
Yes.
The first bit, I can see in that in most of the courses that we need to, in order to gather the points, initially we need to talk important points that it gives us marks, right? You did it very well.
Yes.
But how to make it short and how to both take the point and do not waste the time. Do not say full sentence. If you say long sentence, it matters. Seconds matter in this exam. Seconds. So you need to just say quickly the important points. Quickly. So I have made this slide for you about it.
Okay.
You would say, hello, I'm Nazia, I'm ready. First, hello, I'm Nazia, I'm ready. So then they will say, okay, this is your list. How can you prioritize this? Okay. So you will say that I will see the available staffing, their competency, availability of the OT, and the anesthetist team, neonatal cots availability, and then I will go room by room. I will prioritize my cases. I will make a plan and involve the seniors if I have problem. Okay, if you do not say this, involve or call for help in case if I need. If you say that I will not, if you forget this point, this is very important. If you forget this point, it means that you're very arrogant and you are one of those who feel that you are a superwoman. You can do all the stuff by yourself. Okay, that is the thing. Just make it short. I will say available staffing, anesthetic team, neonatal team, operation theater. I will go room by room, call for help if I need. It was not 1 minute even, this thing that I said.
Yes.
Do not say I will ensure the availability of cots. No. Say first I will ensure or I will consider this thing. First, this one I will consider. Not 10 I will consider, okay? 1 I will consider. Available staff, operation theater, cots, cots availability, anesthetic team availability, availability of blah, 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 blah. This 4 points or 5 points. That's it. And then you go to the first room. Okay, first room. Do not read it. You spend a lot of time in reading. This is a para 1, 40 plus 2, 3 centimeter. No. Say room 1. Room 1, for example, Mariam, room 1, Mariam, I can see that she had a cesarean section and she had 2.5 liter of blood loss. She had an EBL of 2.5 liter. May I please know, what do you want to know? This is important. First thing, do not read all this information. I'm teaching you. This is after 1 year of hard work, I can understand this point, that I should not read all these. Because it is there. I don't need to read it again and spend my time. Yeah. So you say, yes. Mariam is a post-cesarean section with a blood loss of 2.5 liter. I'm concerned about her. What is the observation? What is the observation? What is the abdominal finding? Is she bleeding? Is she not bleeding? So then I need to upgrade my Zoom. So then they will tell you, okay, so this is an atonic uterus in the theater contracted with ergometrin symptom, and ergometrin has been given, and hemoglobin is 7.5. Okay, so now then bleeding is continuously happening, pulses are 130, and blood pressure. So this bit, that the information can be different. It is one of the very frequently coming recalls. That's why I have added this on my lecture today. So then what you need to answer, you just need to you need to grab the point, catch the point. There are so much confusions. Just say either it is high priority or low priority. Or say it is a red patient, amber patient, or green patient. Okay? Just say red. Red is very short. It takes short time. Or say high priority patient. Okay? Or say urgent. Urgent is also acceptable, but say one of them. Okay? So this is high priority patient. I am gonna involve the whole team, multidisciplinary team. I will activate the emergency buzzer and MOH protocol because she has lost more than 1.5 liter, right? So MOH protocol. MOH protocol is for those who lost above 1 liter. Some of the trusts above 1 liter, some of the trusts above 1.5 liter. Before that, you should not activate this. And then when you activate this MOH protocol, what do? You just grab a phone, call major obstetric hemorrhage, labor ward, room 2. That's it. Labor ward, room 2, major obstetric hemorrhage. That is the thing. And then when you say this, automatically there is a group of people who are gonna be called. That is basically your multidisciplinary team. It would be your consultant who will get this call. It would be the anesthetic team who will get this call. The blood bank. Anas knows all these. Anas, are you there? So
yes.
These things, right? Am I right, Anas?
222 major obstetric.
Yes, 22. If you call 2222 and then say major obstetric hemorrhage, this room, Falana room, and with this ward, that's it.
Yeah.
And we have the same 2222 for bleeding, for maternal collapse. For what else? We have 2 more things. Cardiac arrest.
Cardiac arrest.
These stuff, okay? Not MOH. We have 2222. MOH is one of them, okay? That is specifically for this patient. And then that is it. You got the point from the prioritization, 1 score you got. From involving your MDT, you got another score. From understanding the system and involving and activating 2222, another call. And emergency buzzer also, you said. Emergency buzzer is a buzzer which works just in one area. Let's say this is the labor ward. We have 30 rooms in labor ward in our hospital. So this emergency buzzer, when we pull it, just those people who are around us in this story of the building, they will understand. Not the blood bank, not other people, okay? So this is important that you mention both of them. You want your team to be with you, the same team which is in the labor ward, and you want the other team, which is the MOH team. They need to be with you. right? If there is a maternal collapse, we have a collapsed cardiac arrest team. The cardiac arrest team will come to you, right? So 2222 is different from emergency buzzer. If you do not say this, you will fail this station, because it gives an impression to the examiner that you don't know the system. Okay? So this is important. Just say high priority, involving multidisciplinary team, pulling emergency buzzer, calling 2222, activating the APH protocol, seeing that I can see that she has been giving ergometrin and syntocinon. Do not repeat this. Say that I will say that I will give the next line uteritonic. Do not say anything else. Just say next line uteritonics. Because if you name it, for example, if you say misoprostol, it is the last line. If you say, for example, carboprose, it would be the fourth line. Right? So it means that you're confusing yourself. So just say the next line uteritonic. This short, next line uteritonic. That's it. Do not say that hemoglobin is 7.5. Nazia, you said 7.5 is the hemoglobin. You wasted the time. Why you repeated the information, right? Don't say that.
Okay.
PPH protocol, next line uteritonic, resuscitation of the patient. So you communicate it, right? And then now you resuscitate the patient. So PPH protocol, ABC approach, giving next line uteritonics, giving IV fluid, calling for operation theater, okay. But if this lady is in the recovery room or she's in the ward, we need to take her back to the operation theater. Yeah, because she's still bleeding. She might need to have a hysterectomy. She might need to have the Bakri balloon. She might need to have some other next step of intervention. Yeah, you do not need to mention those, but I can just say that we need to transfer this patient to the operation theater. If you see, maybe in this case she's in the operation theater, but in some other case which she's not in the operation theater, you need to say that urgent transfer to operation theater. Yeah, for the next system. So these are basically the points that you will score from it. But if this patient has got a bleeding of 500 milliliters and you say that, oh, I will activate 2222 MOH, then you fail the station. Because MOH is not for 500 milliliter. Even if the patient is actively bleeding, you need to help the patient in the room. In the room, there is a lot of, facilities provided for you. Right? Am I right, Anas?
Yes, you are right.
Yes,
right.
Thank you.
Yeah.
So coming to the next room. In this room number 2, this is a para 2 lady, 38-weeker, previous to cesarean section, planned for elective cesarean section, 3 contractions in 10 minutes since 7 o'clock, yeah? So the information, one of the possible information that give that she has got signs of she's fully effaced, 4 cm, membrane intact, CTG is also normal. So this is a low priority case, right? This is it's not a high priority case. So you will say, and then one important thing, in these cases, you will not get scores out of these. You will get a score out of the managing emergencies. Yeah, but still it is important that you need to address it appropriately. Prioritize it. It is a low priority. I will allocate either your ST2 or your midwife. And she is a booked patient who wants to have a cesarean section, right? So your ST2 would be better option, I believe. This is my learned from my own experience that if we involve ST2, it's better because ST2 can help you with the consent, with making sure that this patient has got group and safe valid, the patient has got a blood test, full blood count done, Eusenes and LFT done, because if the LFT and Eusenes is not done, the anesthetist will not be able to give anesthesia for this patient. So it's important that the liver function, kidney function should be done. Okay? Always say that. So ST2, we said that low priority, or we can say amber. So ST2, make sure she's consented, blood's ready, theater is informed, anesthetist is informed. Move to the next patient. Don't waste time here. Come the third patient. The third patient was a paranot, 41-weeker. She This is your second emergency.